So many of our clients are shocked when they realize that their reflux symptoms may have been going on a lot longer than they realized, because when we think about reflux, we often think about heartburn or chest pain, but there are a lot of other symptoms of reflux that can be sneaky and that we may not realize they are reflux. And understanding your symptoms is one of the most foundational pieces towards reflux relief, because we really want to understand how reflux is manifesting in your body. So in today's video, we're going to be talking about what are the symptoms of reflux, what are some of those sneakier symptoms that may not be as associated with reflux but could be a sign that reflux is a problem in your body. And if you're new to this channel, my name is Molly. I struggled with reflux for years. I actually started this channel to share more about my reflux journey, and I had really severe GERD. I was on PPIs for over a year. I was able to overcome my symptoms through a holistic approach. So I saw every doctor, I tried every diet, every supplement, and what really helped me was taking control of my health, my nervous system, my stress, and approaching it from a holistic point of view. And so I have an updated video here with my journey and how I overcame GERD and came off of acid suppression. But in today's video, I want to take you through some of these symptoms that you may not know are reflux related. So there are different types of reflux, and I want to start by just talking about the main types of reflux. And I could talk about this subject forever, but I'm going to try to be concise about the types. One type is called GERD, gastroesophageal reflux disease. And this is typically associated with a type of reflux that is acidic. So there is non-acidic and acidic reflux. And so GERD is usually diagnosed with an endoscopy, and they usually see some sort of erosion in the lower esophageal junction, this junction that connects the esophagus to the stomach, or the esophagus, or some sort of inflammation, maybe esophagitis, maybe some gastritis, inflammation of the stomach lining. But usually there is some element of inflammation or erosion with gastroesophageal reflux disease. And typically the symptoms of that are heartburn, chest pain. There may be some difficulty breathing or throat burning, throat pain. You may have a sensation of something stuck in your throat. You could have pain right underneath the rib cage, in the upper abdominal region, or maybe pain in between the shoulder blades. So that pain in the upper abdomen and in between the shoulder blades is actually this lower esophageal junction area. And some people feel that in their front or their back. And so that is something important to note, because sometimes people are having that back pain and they don't necessarily know that it could be related to reflux. And a really common thing that I'll hear from my clients is that the pain feels almost like a pinching in between their shoulder blades. So those chest symptoms are often associated with GERD, but there are other symptoms like coughing, postnasal drip, or even regurgitation. Now, I mentioned there's another kind of reflux called non-acid reflux, and this is usually associated with laryngopharyngeal reflux, or LPR, also known as silent reflux or respiratory reflux. So LPR has many names, and it's usually associated with non-acid reflux, and it's usually due to a little enzyme called pepsin. And pepsin is in our stomach. It helps us digest our proteins, but when stomach contents consistently move into the esophagus, it brings pepsin with it. And when pepsin is in places it shouldn't be, it can actually burrow into the tissues of our esophagus and our throat. When pepsin is in the tissues of our esophagus and throat, it can be very inflammatory. It can be very painful, or it may result in certain symptoms that have nothing to do with heartburn. So people with LPR often have voice hoarseness, they may have postnasal drip, coughing, difficulty breathing, some feeling like something is stuck in your throat is a really common one, mucus production. I feel like I'm forgetting one, but really these symptoms are more concentrated in the throat and respiratory symptoms. That's why it's often called respiratory reflux. So that pepsin that lives in our esophagus and our throat, every time we eat something acidic, the pepsin can be activated. So things like vinegars, citrus fruits, alcohol, diet soda or soda, any kind of acidic beverage. This can activate pepsin, and it can trigger those symptoms of the mucus production, coughing, postnasal drip, or even voice changes. Now, current research does not support the permanence of pepsin in our tissues. So it doesn't mean that this is a permanent thing, but it might mean that we do need to go through a temporary period of elimination of those acidic foods in the reflux triggers so that we can take a break from activating pepsin and reduce inflammation. So really important to know that there are different types of symptoms, and you do want to look out for those. And it's also important to note that reflux symptoms can change over time. One of the most common things we see with our clients is that reflux symptoms may start a certain way, like maybe it started with a bitter taste in your mouth or teeth sensitivity or heartburn, and then maybe later as you continue on, these symptoms might shift. And this could be due to changing certain things about your diet, about your lifestyle, or certain medications. If you take a proton pump inhibitor, you might not feel the burning anymore, but you may still get regurgitation, or you may still get that bitter taste in your mouth. One other thing to note about these two types of reflux is that current research is showing that PPIs, or proton pump inhibitors, are not as effective for non-acid reflux. So it's really important to kind of take a look at your symptoms, work with a healthcare provider that you trust and that is educated about reflux so that you can understand your unique condition and how to treat it. And so, if PPIs aren't the best option for you, there are other treatment options. Nutrition and lifestyle is always critical for those with reflux, but we have to address nutrition, we have to address stress management. Definitely go through my acid reflux playlist to learn more, because there's so much information there that could help you support your stress levels, your nervous system, and help you eat in a way that prevents reflux. I also just released a video all about our top 3 supplements for reflux, whether that's acid or non-acid reflux. So you definitely don't want to miss this video, because I go into detail about our top 3 supplements, ones that could actually help you prevent reflux, because in case no one has told you yet, PPIs or H2 blockers or Tums, they don't stop reflux, they just reduce the acidity of it. So you really want to make sure you're addressing this from a nutrition, lifestyle, and strategic supplementation approach. If you're looking for more support with that, we do offer one-to-one sessions. So there's going to be more information down below about our one-to-one sessions. If you're new to this community, welcome. I'm so happy you're here. Definitely subscribe down below for weekly gut health and reflux videos. And I'll see you at the next video.